All right, so obstetrics, neonatal, so obviously pregnancy or labor and delivery, right? Um, so start off with just so you know, the CEO of IQ was just elected president of Sweden. He should have his cabinet assembled by the end of the week. Wait for it, wait for it. Oh yeah, there it is. All right, so obviously most deliveries occur in a hospital setting, right? Which is a good thing for us because um, there's a lot of there's a lot of stuff that goes on at this point in time, right? And um, most of the time, nothing goes wrong. You know, women have been delivering babies for thousands of years, right? Um, but every once in a while, you need to deal with it on the scene. And it was interesting because just the other night, my wife was watching Grey's Anatomy, and I was reading and kind of just laying there, and she spent a lot of time talking about exactly what um, I think of it is there's a whole that I'm terrified to deliver. I know I'm equipped and I know how and but I'm terrified to do it because there's so many things that have to go right for that baby to, make it healthily, right? And it's a scary thing, but you're there to help, you're trained on it, and they've been doing it for thousands of years, and the vast majority of the time everything goes right. So keep that in mind. So as we go through here, it's a terrifying thing to think about. I'm terrified to think about it, and I've been there with my child, with both my children being delivered, but it still terrifies me. Um, anatomy and physiology, we know all this stuff. There's two ovaries. There's thousands of eggs, follicles that contain eggs, right? Ovulation 2 weeks till menstruation, yada yada. Fallopian tubes, they extend out to the ovaries. Fertilization usually occurs in the fallopian tube, and then it moves on to the uterus and attaches. Uterus is the muscular organ that houses the fetus, and then pushes. It's very muscular, obviously. Pushes the baby out. Okay, birth canal is the cervix and the vagina. Right, that's where the baby gets pushed through. Right, here it is. Um, So, a couple of points of reference here. The pubic symphysis, the pubic bone, right? That's a landmark for pushing that baby out. That'll come back. We'll talk about that later. Um, we know where the cervix is, right? We know where everything the rest is here. Notice where the placenta should be, right? Up on the top. Right, vagina is the outermost cavity. That's the birth canal, right? When you hear that reference to. Okay, we know how that works. That's really not an EMT emergency medicine thing, right? Um, but women do produce milk. That's mammals, right? That's the whole point. Um, so yeah, why that one was inserted in there, I'm not really sure. But the placenta should be high. It should be up on top, right? Either top or high in here is where it should be attached. We don't want it to get down low. Okay, when it's down low, it's a problem. Okay, but it should be somewhere up in the top half of the uterus. Okay, placenta. What does it do? It's basically like the lungs almost. It's the mom's blood and the baby's blood don't mix. Right, the mom's blood goes into the placenta. The baby's blood goes into the placenta, and the substances pass. It's kind of like the lungs, right, where materials go back and forth between the air and the blood. In the placenta, it's the blood and the blood. Okay, but the blood itself doesn't mix. If that makes sense. Okay, but substances pass between, so anything ingested by a pregnant woman can cross over. Medications, alcohol, whatever. So the umbilical cord connects from the placenta to right where your umbilical cord, right where your belly button is, right on a fetus. Okay, so there's arteries, there's veins in the umbilical cord, just like you'd think. So the amniotic sac is basically just that, a sac, a encasement around the baby that contains amniotic fluid, usually half to a liter of fluid that helps insulate, like, because obviously water, liquids don't change temperature as rapidly, so it helps literally insulate the fetus, and it's kind of a water cushion, right? Um, So what happens during pregnancy? A lot. A woman's body goes through a lot during pregnancy, right? Um, you're growing another human. So lots changes, respiratory, cardiovascular, musculoskeletal, in addition to hormones, right? Metabolism, all that stuff changes. Okay, so there are complications. There are increased risk for a variety of things, everything from gestational diabetes to bleeding. Um, so everything, your body changes, and so there are some risks to that. Okay, don't usually notice a woman's pregnant until they get into that second trimester, because that's when the uterus starts to grow, right? The baby grows, the uterus grows, and it starts to push around, pushes on the diaphragm, which makes breathing harder, right? You can't breathe as well. There's more blood in your body. You clot faster, right? Your heart works better, actually, right? So they breathe faster, obviously, right? Because you can't breathe as deeply. Women tend to breathe faster, right? Which makes sense. Okay, third trimester. Um, Generally, women tend to get morning sickness. It's called, which isn't just the morning. Spoiler alert for you there. My wife would get sick a variety of times during the day. But first trimester and third trimester are more at risk for that nausea that goes with what we call morning sickness, right? Right, heart's working harder, lungs are working, everything's working harder because you're growing a kid, right? Weight gain during pregnancy. Okay, women, so you start to see them waddle around. Their center of gravity changes, right? So they can't really walk this with the same posture they did. Plus the fact that they've got a giant belly, giant baby, and all the accoutrements growing. So they are going to gain weight. They're not going to get around as fast, right? There's a lot of different complications there. Most of the time they're healthy, right? Especially when they're receiving care, proper care from. Sorry about that. Proper care from a doctor, going to their regular visits, right? Everything's being monitored. They're generally pretty healthy, right? If they become ill, the reason for this one is you can give the mother oxygen, without any issues. Diabetes, gestational diabetes. My wife had gestational diabetes. It is a risk for women in pregnancy. Okay, it's the same principle as any patient with diabetes as far as blood sugars go. Monitor the blood sugars. They adjust their diets. My wife couldn't eat carbs. She was miserable. So, but that does happen also. Hold on, my phone is going berserk here. All right, preeclampsia is essentially hypertension. Pregnancy causes an increase in your blood pressure, right? So you're going to get swelling. They're going to get headaches, right? You'll obviously notice hypertension. It'll be can be some vision problems, partly due to that high blood pressure. Okay, that'll go with that. Eclampsia, preeclampsia is obviously the precursor. Eclampsia is seizures. It's actually that high blood pressure that's been going on for too long starts to cause issues. If we do have a pregnant woman seizing eclampsia, we want to put them on their left side. The reason for that is when they're on their right side or on their back, the fetus actually pushes up, makes breathing more difficult, and causes pressure against the heart. On their left side, allows the heart to work more properly, right? And get them to the hospital, right? You're dealing with a pregnant woman where there's a lot that can go wrong. Having seizures obviously has an issue that causes seizures. Get them to the hospital. Call for ALS. Yeah, the blood pressure drops, right? Here it is. The compression of the descending aorta, right? So you're not getting blood flow down to the lower part, and the vena cava, which is the return, right? So essentially, you're blocking blood flow to the lower half of the body when they are laying on their back, and even to some extent the right side. So, spotting, bleeding, not uncommon, not always dangerous, right? Usually you don't get won't call 911 for spotting, right? But bleeding, when you actually get a bunch of bleeding, generally it's not a good thing, right? So those are some of the things you'll get called to. And again, just pro tip on this one, you're going to want a female EMT if possible when you're dealing with pregnant women with bleeding issues, etc. They're going to be more comfortable. You're going to be more comfortable. So that's the ideal if you can. So ectopic pregnancy is what happens is that fertilized egg does not make it down the fallopian tube and instead implants in the fallopian tube. That's what we call an ectopic pregnancy outside of the uterus. Usually it's in the tube. Okay. The leading cause of maternal death in the first trimester is internal hemorrhage, bleeding out internally, because there's a lot of blood flow to these regions, right? That's what they do, right? A lot of blood there. So if it hemorrhages, if that ectopic pregnancy ruptures, a lot of blood. Okay. So you've got a woman with bleeding, pain in the abdomen, possibly pregnant, but probably doesn't know it yet, right? Ectopic pregnancy is a common occurrence in that stage. Okay. So if there is hemorrhage, get them to the hospital. Generally, it's not a good thing, right? So get them there. It could be a lot of things going on, and we're not going to sit and try to screw around and figure out what's wrong. Okay, a couple things that could be wrong. Placenta previa, which prevent. I take prevent. Placenta is preventing the baby from coming out, right? So that's how I remember the difference between them. An abruptio placenta is when the placenta comes away from the wall of the uterus. It's kind of floating free. That's not a good thing either, obviously. But just remember the difference. I remember the difference between those two. The placenta prevents the baby from coming out because it's blocking the cervix. Right? That's when that placenta gets down to the bottom. Okay, so placentia abruptio. It's come away there. It's hemorrhaging, right? Because it is pulled away. That's not a good thing. And with the placenta migrates to the bottom, that's where you get the previa on the right side there. Okay. Abortion, it's a stigmatized word, right? But essentially, an abortion is any time that the fetus, right, is delivered before 20 weeks. Okay. So oftentimes called miscarriage, it's technically also an abortion, right? That's what it is. Okay. Obviously, not a healthy thing for either party, the fetus or a fetus before 20 weeks is probably not going to make it, but for the parent, for the mother also. So treat for shock because we're anticipating a lot of bleeding, right? And get them going. Okay. Now, this is pregnant women, okay, are at an increased risk of abuse. It's just plain and simple. It's a fact, statistic. So anytime a pregnant woman is, for any type of trauma, right, including abuse, increases the risk of spontaneous abortion, right, other health issues that are going to result in premature delivery or low birth weight. So if you're called to a trauma, an assault, anything like that, just be aware that there are issues that are likely to happen with that pregnancy. Okay. Trauma in general, especially abuse, increased risk for a lot of things. Make sure that woman that's got abdominal pain and bruising and whatever, get them away from everybody else and just say, is everything okay here? We see some bruising. We just want to ask. Okay, tell them you have to ask, right? Because you kind of do. But say, we have to ask this question. Is there any chance that you were assaulted? Okay, blame it on procedure. Blame it on protocol. I have to ask you this, right? Because like you see, you kind of do. Substance abuse, right? Alcoholism, right? Fetal alcohol syndrome, drugs, everything else. Obviously, have a bad effect on the infant, right? On the fetus. So, look for any normal clues of addiction, right? Things around the house, right? You don't have to stare around the house, but you come in, glance around. You see booze bottles, you see pills, you see syringes, anything like that. When you're taking make sure that with that pregnant woman or any people, if possible, take their arm out of the sleeve to take the blood pressure, right? That gives you a look at their arm. Do you see track marks